Hope you're all well and safe. During these times, been seeing, myself included, a lot of tension building up in the neck because of, Skype, Zoom, FaceTime, and generally speaking, we, are on our phones, computers, and hopefully not too much television, which also brings that tension. So what happens is the neck muscles get so tight, which starts to tense up the jaws, and face, eye fatigue occurs, headaches, more shoulder tension, and all that can even affect circulation to brain and even affect the immune system. So I have these techniques, these simple movements. I just call them the neck savers. Of course, after that, I will recommend that if you feel that you can unshelter yourself and get a chiropractic adjustment. Chiropractic, even in the second wave of COVID, we're still on the essential list because we follow the CDC requirements of wearing masks, sanitizing the table, sanitizing hands, and distancing properly. So neck savers. So the first one is basically just gentle neck rolls, and while you're doing these, let's do a nice long deep breathing as well. So it's simply just inhaling, going to the side, and just to your limits. Don't force anything. Side, forward, side, back. Nice gentle neck rolls. Sometimes you'll hear little creaks and cracks. That's okay. Don't try to do that, but just stretch those muscles. And the breathing is an important part. And then after a minute or so, then go the opposite direction. Try to bring the chin to the chest, ear to the shoulder, head back, ear to the shoulder, forward. Breathing. And then after that, minute, even two, just inhale, take a deep breath, exhale, let the shoulders drop. And the second is just to release more tension in the shoulders and the traps, and simply is just inhaling, shoulders to the ears, exhaling down. So it's inhale up, exhale down. And just really bring them up as high as you can toward your ears, and then let them just drop like a dead weight. And while you're doing all of these, be sure to sit kind of straight in your chair, chin tucked in a little bit, inhaling up, exhaling down. Again, after a minute or two, the last few seconds, breathe deeply and powerfully. Inhale, shoulders up, lots of tension, create some tension so you can release it. And then after each, meditate a little bit, bringing in that peaceful, healthy, exhaling tension, stress. The third exercise is simply just inhaling left, exhaling right. Inhaling left, exhaling right. Inhaling left, exhaling right. Again, powerful breath. Go as far as you're comfortable with, and after a little bit, you should be able to move a little further in the direction you're moving. And again, go at a comfortable pace at first. You don't have to do it as fast as I am, but it's a little more effective as you speed up as you warm up. So it's inhale left, exhale right. And breath is through the nose so you don't hyperventilate, and so you don't get dizzy. You can focus at the third eye point between your eyes on at your brow point. And again, last few seconds after a minute or two, go a little further each direction, breathe a little more powerfully, all the while keeping your spine straight, shoulders relaxed. And inhale straight forward, face facing forward. Inhale. And exhale. Again, just relax the breath. Let your shoulders drop further. And this last neck saver is not really an exercise, it's a simple stretch. And what you'll do is reach over your head and touch, in this case, the left hand at the top of the right ear, and you simply just pull, keeping your head facing forward, but you lean and pull your neck and head to the left. As you go as far as you can laterally, then you rotate your head face as you continue to pull. So you're turning and you're pulling with your hand. Again, trying to keep your spine straight and just rotate it like you're rotating your head around an axis. But keep that stretch, that lateral bending stretch, and breathe deeply. You should be able to feel a really strong pull on those muscles on the left side of your neck all the way up to the skull. So 15, 20 seconds. Breathing, pulling further, a little further, and then release, exhale. Let your shoulders relax. And again, next one is hand over your head, touching about approximately the top of your left ear, and you pull your head as far as you can to the right. And when you're at that far point, start to turn as you continue the pressure laterally. So you're turning around that axis. Keep turning and pulling, breathing. And again, you should feel a very strong pull on the right side of the neck all the way up to the skull, where this neck attaches to the skull. Pull laterally, rotate a few more seconds. Final pull, final turn, and release. Give the terminal adjustment. And exhale, let the tension drop, muscles relax. And again, important to breathe deeply throughout the exercises. Go slower if it's comfortable. Stretch as far as you can. And again, like I said, if you feel safe to come out and unsheltered, wise to get an adjustment to keep the nerve supply correct and also the function of your neck working properly, and of course a boost to the immune system. So good to see you all again. Stay safe, wash your hands, wear a mask, distance as best you can, and send blessings, love, prayers.